IVF has been a process that's been helping to grow families for over 40 years. In just 3 months or these 8 short steps, you could be pregnant and counting the days down to your baby's debut. So I think some important things to think about when you're deciding where to do your IVF is, first of all, investigating the clinics that you're looking at. SART, which keeps track of success rates for IVF, is an important resource for patients, but it's also really important that you look at your specific situation. SART will dice up that data however you want, but it's really important you're comparing apples to apples. Some clinics will say that their pregnancy rates are far above the national average, but when you look into their SART database, it might not be that way. So it's really important that you look at that process. I think it's also important that you prepare yourself with as much knowledge as you can about the process itself. What will happen during the IVF process? YouTube is a great resource. Our website's a great resource. Talk to other people who've been through IVF. That's another great resource that can help you along your journey. I think it's also important that you have a support system. Infertility can often be a really lonely disease, and it's really important that you find people to help you along this journey and support you. Family, friends, other people who've gone through IVF might be a really valuable support system through the highs and the lows of the process. I think it's also important that you realize that the process of IVF is really a lot of time and energy, and it's really important that your schedule is amenable to that kind of a time commitment. You shouldn't be doing IVF when you're in the middle of a busy engagement with work, you're changing jobs, other life events are happening, you're moving, because you will have lots and lots of clinic visits, ups and downs emotionally, and it's really important that you can devote your time and energy to this process. Some supplements that we generally recommend for our patients are prenatal vitamin of some sort. Whatever you tolerate really is okay. CoQ10 is often a supplement that fertility specialists will recommend to our patients, especially those with a lower ovarian reserve. I think it's also really important that patients try to maintain as healthy a lifestyle as possible during this process. Avoiding things like excess alcohol, excess caffeine, really exercising in a normal, healthy way, avoiding things like cigarettes, really, really important in terms of getting a really great outcome with your IVF cycle. I always tell my patients that optimizing their weight is really important in the road towards fertility. Now, does that mean I want you to start some crazy diet or fasting, etc.? No, because those sorts of crash diets can lead to hormonal shifts that really interfere actually in the fertility process. Leading a healthy lifestyle, a good amount of exercise and dieting can help to get to that optimal weight that will help you on your journey towards parenthood. When you get your box of medications, it can be really overwhelming for IVF. And I think it's really important that you have a calendar somewhere where you really put down step by step what you'll be taking. Your nurse will help you to create this calendar, and together you'll create a system that works for you in terms of making sure you don't miss anything. There's a lot of opportunity to make a mistake, but the goal for us is always for you to never have that kind of a problem, always have all your questions answered, and so it makes it as easy as possible for you. I think during this process, it's very easy to become overwhelmed, and anxiety plays a really big part of that. And I think it's really important that you take time for yourself during this process to lower that anxiety level. If that means walking your dog, acupuncture, yoga, anything really that will help you to get through this process and make it easier for you, I think is really important. The most important thing for you to know is that during this whole process, we're here for you. We want you to ask questions. That's why we're here. So if you have any question that you have left unanswered, please reach out to your coordinator, reach out to your doctor. We are here for you. We want to make sure this is as easy as possible for you. While IVF is a highly effective method of overcoming infertility, some things that you do actually do affect outcomes. And it's really important that everything is optimized in your life for us to get to the end point of this journey that we want together.